Hello, I'm Katie Adams in MedCity News, and I'm here with Sam Labson, the Vice President of athenahealth. Thanks for being here today.
Thank you for having me.
First, I want to talk about interoperability because I know that there's still a lot of challenges that remain to achieving that in the healthcare world. But I'd love to know where athenahealth steps in and what you're doing to address those challenges.
Absolutely. athenahealth has interoperability in its DNA. We've been trying for a very long time to establish connectivity wherever a patient might be seen in the healthcare ecosystem. The challenge today is still 70% of all patient information that's shared is on a fax machine. And we really, at this point need to move beyond sharing information in analog signal and make it digital for our clinicians and for the systems that they use to consume that information into this new set of tools that are making kind of the ingestion and synthesis of information available at their fingertips.
This type of enhanced, boosted interoperability, can you describe the results on patient care, on the clinician experience?
Yeah, absolutely. What we're seeing is that, the more we lay these pipes that establish connectivity with, whatever sources a patient might have been seen at, the more that brings context to the conversation that a patient might have with their doctor. A patient is seen by, on average, a Medicare patient is seen on by average 4 different facilities, 7 different doctors. And so having that, reach and connectivity to bring information in allows for a clinician then to utilize that information in the workflow. However, before these new enhancements were there, the job was really challenging. They had to go into, a document that might be really long and have a bunch of extraneous information when all they're looking for is maybe an allergy or some kind of medication reconciliation workflow. Today, with generative AI and some of the capabilities that we're really enhancing in our EHR, having an AI native encounter that essentially allows that information to be presented presently in the clinician workflow as they're talking to the patient or in their prep for the patient, and really, has really revolutionized what we're doing with the outside information so that when you have an allergy that was recorded at the university hospital, when you're in with your doctor that's using Athena, they see that face up when we're talking about allergies in that medication history, and it makes the workflow around outside information that much better.
Yeah, and during the workforce shortage and the burnout crisis, we don't need doctors and clinicians bogged down looking for allergies.
Exactly.
Well, in these conversations around interoperability, I often find myself thinking a lot about value-based care because industry has been struggling to achieve true scale with that for a while, and it's very hard to do when you're operating in these data silos. So can you talk about what it looks like in practice for interoperability to kind of enable more value-based care?
Yeah, absolutely. I don't believe we truly can achieve value-based care without interoperability. Because if you think about it, the core tenet of value-based care is taking care of someone's whole life. And when we mentioned the flow of patients from ambulatory to acute to post-acute, their data is being collected and moved from place to place. And without centralizing something like a care navigator, a care manager, and having some kind of analytic capability to say, what's happening in that patient? Are they someone who just got diagnosed with diabetes and might have a kind of an increasing set of issues to contend with in the healthcare system? Do they need that intervention? And then providing to the care manager the ability to see, yes, this person has this risk score based on all these factors about information that was collected through interoperability, and then utilizing kind of that centralized care management function to really bring value to the patient and the member, who is then kind of needing to move to the next level of care, the next level of commitment from their care providers and their care team. So hugely important to have access to information when you as a patient have given, you've trusted the healthcare providers to take that forward. I'll make one more point, and that is that it's not just a care team. If you're going to provide value-based care, the patient can also do a lot of the work. And so we really think about interoperability, not just in terms of getting data from other health systems in, but how do we get the data to the patient and where the patients are? You know what's happening right now? 40 million U.S. citizens are asking ChatGPT health-related questions every day. So how do we make that data that they have in their clinical record available to them in something like ChatGPT or something like Claude? That, I think, is the next frontier of interoperability, is really how do we light up not just the clinician's AI tools, but also the patient's AI tools with the data about them to help them consult and navigate their care even independently.
Oh, well, it's one thing to connect all of these different providers and all these different systems of data, but it's another to bring the patient into there and to kind of close that loop and make that data useful to them and something that they can learn from and use to make themselves healthier. So thank you for explaining that, and thank you for being here today.
Absolutely. Thanks for having me.